Doctors of Reddit, what's the craziest shit you have ever seen? Not the craziest, but one of the most memorable. I was working urgent care early in my career and had a lady in her 60s check in for hemorrhoid for the past 2 weeks. Usually straightforward. Walk in the room and she describes the typical presentation of a hemorrhoid and states she's had them before. So I tell her to undress and put on a gown and I'd be back in with my chaperone. The medical assistant and I walk in and she's bent over the exam table with her bare ass towards us and asks, "Do you see it?" It looked like there's a tail hanging out of her ass the size of an Arizona iced tea can, except it was her rectum and colon. She had a complete rectal prolapse. One of the worst I had seen, and she thought it was a hemorrhoid. Was in medical school on inpatient psych. Happened right before I got on the rotation, so I didn't directly see it, but everyone was talking about it. Lady was in a schizophrenic episode and she pulled out her own eyeball with her finger and severed the vessels and nerves, then proceeded to eat her eye. She said it was because she wanted to see inside herself. I used to dread getting the eye gougers on my unit. Eyes are my kryptonite and these patients were either floridly psychotic with no end in sight, pun intended, or horrified by what they had done while psychotic. Worst one was the guy who had removed his eyes, shoved them up nature's exit, and then placed D-cell batteries in the empty sockets. He also had a golf pencil up the urethra because why not at that point? Not me but a family member. They had a 6-month-old baby come in with a stab wound to the abdomen. Intestines coming out from baby screaming. Mother claimed that she dropped a glass bottle on baby. Her boyfriend stabbed the baby. Baby survived, though almost went to foster care when the father refused to get them. Very sad. Some worst ER stories can be funny, but this one is absolutely devastating. I'm trying to picture it and I'm sure it's even worse than my imagination. That poor tiny baby with adults around that failed them so miserably. Straight awful. We wanted to foster the baby if the father didn't get him. My sister saved him. The mother was arrested for it initially. I am an EMT. Last year we pulled up to a house because the mom had called about a violently ill child who was vomiting profusely and had extreme abdominal pain. We got there and the 9-year-old was practically dry heaving and she's doubled over in pain. It turned out that in the span between the time the mom called and the time that we got there, the little girl got the runs coming out the other end, all the way down the hall to the bathroom. The older sister was supposed to go to soccer. While her mom was on the phone with the dad, she walked out into the hall, slipped on the poop, and fell down the stairs, injuring her shoulder and head. The mom had heard the noise, came to the bottom of the stairs, and tried to catch her other daughter, but her soccer cleat hit her in the face, splitting her forehead open. So the 9-year-old daughter had a burst appendix and needed emergency surgery. The 12-year-old had a visibly displaced broken collarbone and dislocated shoulder as well as a minor concussion, and the mom had to get 18 stitches total on her lip and forehead. Everyone's covered in diarrhea, the younger girl is groaning, the older one is oddly quiet due to the concussion, and the mom was a mess. We get to the hospital. The dad is already waiting at the ER and this man is recovering from ACL surgery. Ambulance brought in a guy nearly dead from a gnarly high-speed car accident. The ambulance crew was immediately paged to go run another call. Meanwhile, the car accident victim dies in the ER. The ambulance is back 45 minutes later with an elderly lady who fell at home. She kept asking us to call her son to tell him she was in the ER. She was concerned because she had talked to him over an hour ago and he was supposed to pick her up and take her to the ER. Turns out he was the car accident victim who was racing to his mom's house. She was brought in the same ambulance gurney that her now dead son was just laying on. Gut-wrenching. My friend worked the ER room during his residency and he said a 12-year-old came in with a kitchen knife sticking out of the top of his head. The tip was just stuck in his skull. He was playing basketball and 2 kids were arguing. One goes home, grabs a chef's knife, goes back to the playground and just plonks this other kid in the head with it, luckily just with the strength of a 12-year-old. What the fuck? Talked to another med student who had done a 4-week ER rotation. One of the weeks they decided to do a few night shifts just to see if there was any variety in cases. Absolutely nothing happened all night, seemed like a waste of time. Then in the last hour a patient came in where they had to do a full clamshell thoracotomy, literally cut the ribs and fold open both sides of the chest. This is maybe a once-in-a-career procedure, and they saw it on their first night. All went well, but apparently the registrar who did the procedure, asked someone else to do the next few procedures, was trembling from the adrenaline dump. Patients coming in psychotic can be interesting. Their delusions are totally reasonable and true to them, Even if it's, aliens are breaking into my house and adding stimulants to my milk while my back is turned, and they can't be persuaded otherwise. Also cases of people doing things like trying to circumcise themselves or do a labiaplasty, cut off some of the labia for aesthetic reasons, and getting about halfway before deciding it's not really a DIY procedure. I think the more common but sad is the ones coming in for a cough or migraine and finding out they have cancer or have had a stroke and it's past the point of treatment. Doctor of middle seniority, not finished training but with 6 years of med school and at least 3 to 5 years work experience. Former EMT here. A few years back, we responded to a call for burn victim. We could smell the charred flesh coming up the driveway and ultimately found a woman in her early 30s who had tripped and fallen directly over a small bonfire pit. Her husband, a firefighter in a neighboring county, had found her and pulled her away, but it was far too late. Her entire body above her knees was charred to the bone and her internal organs had spilled out of her burst abdomen. Fortunately, she likely was knocked unconscious after falling, as evidenced by some bricks disturbed from the fall with blood on them opposite the side she would have tripped over. Likely she suffered a major head injury and was hopefully spared the pain of burning alive. It was a rough one for sure, but mostly for the poor husband, who I believe a few months later quit the fire service. Have a few more that involve major trauma to the head, shotgun suicide, etc., but those were all pretty similar. I was an intern, first-year physician, assigned to the colorectal surgery service. As a noob, I naturally got only the best, most prestigious of jobs. This of course included helping manually disimpact constipated patients. This involved placing anal suppositories and enemas, then fishing around with my fingers to get things moving. There was a 400 pounds patient who hadn't shat in weeks. By this point in the rotation, I was getting pretty good at getting things moving. I did my thing, and after removing my finger, the poo starting flowing. Nothing dramatic happened, for example no fountain of poo shot past me, but the poo just kept coming. It had a texture somewhere between pudding and soft serve ice cream, and it just kept coming. It filled the space between his legs and then flowed down onto the floor. He shat continuously for almost 30 minutes, volumes of shit I didn't know a human body could hold. Truly something to behold. Not me but my cousin. She knew she wanted to marry her fellow pathologist boyfriend, at the time, when he called her over to look at a picture on his computer of a woman spread eagle that had a small suspicious patch on the outside of one labia. It was one of those weird porn solicitation emails that were really common in the early 2000s. He wanted her to look at it to confirm his suspicions and then emailed the address back stating he wasn't interested but to go to a doctor immediately for testing. Close to a year later he got an email back, from a different email, thanking him for suggesting to go to a doctor because it was a melanoma. Guy is 10 out of 10, cousin married well. He tells that story to everyone. Story from my mom. She is OB/GYN in a high-risk hospital, but a lady ended up barricading a room she was on PCP pretty hard. By the time the doctors got it open with security help, she already gave birth. For 3 days straight she was telling everyone how she was the doctor, not them. This is actually so fucking hilarious. That's 1 out of 3. When she started at the ICU back in the 80s before making up fake names for mob and gang members, it wasn't uncommon for a rival to go inside and finish the job. She happened to be close to a mobster's recovery room when they popped in and finished him off right there in the hospital. There was a serial killer who would stuff victims in a barrel in Kansas City back in the day, and they got one of the barrels in the morgue and opened it. Half the hospital had to move rooms and the ventilation system had to be shut down and all filters replaced. It was that bad. My daughter is a physician assistant in the ER. 2 months ago they had to open a guy up to remove a real life-size foot dildo from his intestines. He was in his 60s and his wife was there. She admitted to inserting it, and they couldn't get it out. All of these are unknown years ago, unknown location and no marker other than gender. I had a dude come in with a concern of allergic reaction once. Invisible, unmeasurable symptoms. He brought the live muscle in a jar of water that was the alleged trigger. Surrendered it. We kept it around a few days after his discharge, a little mascot, as it were. We've all had psych patients escape up into the acoustic ceiling tile, but one time, a dude disappeared and we couldn't find him. Around that time we were getting meal trays delivered in a cart that had tall layered slots and sliding doors, for infection control reasons. So the meal cart is hanging out near the place where we had people waiting for inpatient beds, and eventually one of the techs tells me the cart is muttering to itself. Dude wasn't dangerous, he just seemed to feel safer inside a tiny cozy place and found it. I personally saw one man 3 times in 24 hours. First he came in for something. There was a traffic violation and some shenanigans that resulted in him tased and brought in cuffed, face down. They don't transport in that position unless people have been naughty. Anyhow, I assessed for injury, toxic ingestion, got him medically safe and discharged to the officers. I finished my 12-hour shift, he got himself bailed, we each went home, got some sleep. I came back for another 12 and there he was, concerned at how sore he was after being tased. So we did a careful workup for rhabdo or any other side effect of tasing, he was fine and discharged. Dude returned within 2 hours with a fresh stab wound in the back. Like, hey, when the ER doctor says you might need to sort your life out, that's a pretty extreme bit of advice. He was, again, okay, but dude. I one time did a thing that was against my training. A fella put a knife in his neck before coming to us. Walked in, actually, past the grannies and kids in the waiting area. Teaching is to not remove impalements without imaging, but he has a deep history of shenanigans with staff and I don't want my radiology staff getting injured, so, with police standing behind me, and honestly my heart in my throat, I just removed it and passed it blindly to someone behind me. I figured if it had penetrated a major vessel I could apply pressure more safely after the sharp thing was gone. Vessel imaging afterward showed the knife had been 2 millimeters from the carotid. Maybe the saddest, a person brought in hit by car, and this isn't at all a trauma center, it's a tiny place, we have like 6 staff total overnight, physician plus nurses and techs. The local EMS didn't bring us things unless it's obviously hopeless or they're concerned they can't make it to the trauma hospital. This was the hopeless kind, they were mush. The nurse recognized them by their jewelry. Hey, this is a person we had seen routinely for years for some mental health stuff. Seems they had, dressed all in black, jumped into a state highway in front of traffic. Well, 30 minutes later we get some dude who is having severe chest pain and panic because he thinks he might have killed someone on the road. Like, I only have about 6 patient rooms at this time of night, 100% the staff taking care of you are taking care of the person that died. We none of us blame you, the cops testify you stood on the brakes, tried to avoid it, didn't run from the scene, this person we know for years had voiced some very difficult suicidal ideation. But we can't tell you any of that. We did a pretty big cardiac workup on that guy to make sure his body didn't suffer injury from the stress, checked into his support systems and follow-up. It wasn't appropriate to tell him anything about the dead person beyond, cops at this point don't see you as at fault, can we find you more support? It was nuts trying to keep everyone separate in a small place when we can't clear the body, the cops need to photograph the dead, and we need to not trigger the driver, who honestly I saw as a victim that night. My relative's story. She was working in the ER one weekend. A woman was brought in bad shape, she had been in a single car accident. She was speeding, not wearing a seatbelt and on her phone. She was also pregnant. By the time she got to the hospital, there was no longer a fetal heartbeat. At any rate, the lady survived but lost the baby. Then the craziness started, she sued my relative and the hospital claiming that their negligence caused the death of her baby. Obviously, this was BS, but some ambulance chaser had gotten his claws into her. After months of litigating, my relative was furious to learn that hospital decided to settle. She went in to complain to the admins about why they settled when it was clearly a BS, frivolous lawsuit and neither she, nor any other staff had done anything wrong. The lady caused the accident herself and the baby was already deceased when she came into the ER. They told her that it was easier and much less expensive just to pay the lady $50,000 and have her sign an agreement to forego any future legal action than to continue litigating. System is fucked. So lady in southern rural Oklahoma who got $50,000 out the local hospital, it's your fault that your baby died. Wow, I'm a healthcare provider in rural southern Oklahoma and I wish this shocked me. Not me, but happened at my hospital. Patient macerated their own penis. Turned up to the triage window holding pieces of their penis. Needless to say there were some psychiatric and substance issues. Were those issues before or after the penis thing? Long before. It's hard to remember as this was like a decade ago and I was quite new at the time. From memory it was a long-term psych patient who would self-harm every time they were discharged. If I'm remembering correctly, this same patient also presented to ER the day after psych discharge having swallowed a dozen razor blades. Perhaps I'm conflating them though, they all blur together. ER is a crazy place, I don't think most people realize just how many drug-affected or mentally altered patients come through. Shows like The Pit don't even come close. At my hospital something like 25% of presentations were acute mental health episodes or drug overdose. The ER is also a wildly inappropriate place to treat these patients, bright, noisy, chaotic. We ended up building a separate section for treating them. I have a happier one: super early catching of lymphoma. A person came to the hospital because their dog had yanked them hard enough to hurt their shoulder. In the exams and workup, abnormal lymph nodes were found around the shoulder and armpit. That led to one of the earliest diagnoses of diffuse large B-cell lymphoma that the oncologist had ever seen. It was very personal for me because they were rather anti-medicine. Did not want to take medications, rarely went to the doctor, and had a general distrust of all things medical, so this would have probably not been caught until it was far too late. I spent a lot of time with them to walk through their chemotherapy regimen. There were several drugs, some much scarier than others. They were originally not going to pursue treatment due to their distrust. The last time I saw them, they were sitting in the chair getting their first treatment. I still wonder how they are doing. Was an EMT for 6-ish years. We had a really busy day, talking back to back to back, constantly running. So my partner and I had gone the entire day from about 7 a.m. to almost 8 p.m. without eating. We got a call for a gentleman who worked in a Chinese restaurant. He was mopping when he tripped over his mop bucket and his arm up to just past his elbow ended up in the fryer, which was of course boiling. His arm was pretty rough but nothing incredibly seriously, probably second-degree burns all the way up his arm. We were transporting him to the burn hospital, which was unfortunately 45 minutes away. He was stable, and if we'd taken him to any other hospital they'd just send him to the burn hospital anyway. Pretty routine call. I drove while my partner kept an eye on him in the back. About 15 minutes into this drive I start to notice a smell. It smells like fresh fried pork, something like tonkatsu. Mind you, I hadn't eaten all day, and the smell actually had my mouth watering. My mouth was watering at the smell of this poor man's deep fried arm. Brought it up to my partner afterward and he looked at me like I was a psycho, rightfully so, but afterward assured me that I was probably just smelling leftover oil on the patient's clothes. Nice thought, but I kinda doubt it.